Hello, everyone. My name is Nicholas Moore. I'm an MSW and ACSW here at NLSLA, and I'm here working with the disaster team. Today, I want to talk about trauma-informed practices in disaster settings, specifically about what trauma is, understanding disaster trauma, the core principles of trauma-informed care, trauma-informed strategies for disaster settings, and provider well-being. I will be saying the word trauma a lot in this presentation, so just bear with me, please. If you have any questions or feedback, don't hesitate to raise your hand. Thank you. All right, for starters, what is trauma? Right? I think it's a good question. Well, trauma-informed practices help attorneys recognize the role trauma plays in the lawyer-client relationship. Integrating these practices helps to increase the connections with disaster survivors and improve advocacy and assistance in the recovery process. Participants will hear about the impact of traumatic experiences on disaster survivors and how to help navigate legal issues after the aftermath of disaster. So trauma, what is trauma, right? It refers to intense and overwhelming experiences that involve serious loss, threat, or harm to a person's physical or emotional well-being. What's this mean? Well, individual trauma results from an event, right? So a series of events or a set of circumstances that is physically or emotionally harmful or life-threatening. Collective trauma is felt by a group of people. So this is where trauma can kind of differ. Collective trauma is often felt and faced by frontline communities, specifically communities of color and low-income communities that have faced historical disenfranchisement, housing displacement, discrimination, and poverty. And natural hazards and disasters can also aggravate this trauma. Right, these experiences can be sudden and occur at any time in a person's life. It's very important to think about that, right? It may involve one traumatic experience or repeated experiences over a number of years. Okay, continue. Right? It can overwhelm someone's coping resources, right? So trauma can really overwhelm the ability for someone to cope, and it can undermine a person's sense of safety in the world, right? And create a sense of that catastrophe could strike at any time. We kind of call this hypervigilance. Individuals may find ways to cope immediately, but may be harmful in the long run, right? So when we interact or create communications for individuals impacted by disasters, we must first acknowledge that they've been through an event or a series of events that have been physically or emotionally harmful or life-threatening, right? So this is key when working with people in disaster contexts. It's an individual experience, right? But what may cause trauma for one person may not apply to another, right? So it's not blanketed. It's not if you go through this, this will happen. It's based on the individual and the individual backgrounds. Okay, understanding disaster trauma. What's this mean? What is a disaster? I think we have to first start out by defining that, right? So what is a disaster? It's a diverse set of events ranging from man-made, right, like terrorism, maybe school shootings, unfortunately, right, to nature cost, um, a tsunami, right? These are unexpected and uncontrollable events that have a major impact on people's personal, social, economic, and well-being aspects of their lives. Okay, so having a trauma-informed approach in a disaster context requires communities and decision makers to really come together and understand the impact of historical trauma, right? And also anticipate potential traumas that may arise during a disaster and invest in programs and processes, right, that minimize and mitigate these traumas. That's what being trauma informed is all about, right? And disasters are becoming more costlier. We know that historically, right, from 1994 to 2013, the Emergency Events Database recorded around like 6,800 natural disasters worldwide. And on average, this almost claimed 70,000 lives per year and affected almost 220 million people each year. And so disasters are a fixture sort of this society and how it has been affecting people. It has broad reaching effects. Environmental and demographic trends are leading to more extreme disasters as well, right? And associated with socioeconomic trauma, especially for more vulnerable populations, right? Um, this can perpetuate these problems even worse, along with the coastal inundation, which means, how a lot of cities and big cities are coastal near ports. This is expected to worsen in many places. And just my last point, right, with a disaster is FEMA has a national risk index, right? It's a tool that contains county level data for a risk index, an expected annual loss, social vulnerability, among a number of other factors. Um, And Los Angeles, actually, their risk index served as very high. So the community that we're in right now, the risk is very high. The expected annual loss is also very high in the index, and the social vulnerability is relatively moderate. And so we do know that we're currently living in a community that has a very high risk index and a very high expected annual loss index. And so these things not only affect people globally, but also here locally as well. So when we talk about the populations, what are the populations that are most at risk for disaster, right? Are there certain populations that are more or less at risk? And yes, there are. There's high risk communities by race, of course, and ethnic majority. There's also populations that are most at risk from different historical reasons, right? Or maybe ability reasons. So individuals with disabilities, older adults, right? Immigrant or rural populations further from city centers, further for programs, further from emergency response services, right? Communities of color, low income communities, right? So the impacts of disaster, including trauma, may not occur equally or equitably. And they can also serve to amplify these pre-existing vulnerabilities and inequities, right? So these low-income populations and communities of color, right? They live in places vulnerable to more fire, flooding, and other hazards, right? Environmental hazards. And so poverty remains the most significant vulnerability indicator, right? But also another indicator is marginalization, right? Resource dependency, institutional resilience. All of these things factor into what makes a population higher or lower at risk in a disaster setting. So what are some of the ongoing barriers, right? We do know that when these disaster happens, there are some barriers for populations trying to get the help or maybe trying to get through the processes of becoming whole or being, I would say, paid out for some of their losses, right? So what are some of the ongoing barriers for our disaster clients when working with organizations like a FEMA or maybe a legal aid, a Habitat for Humanity, anything like that? What are the barriers? Well, we do know that excessive or burdensome paperwork can be one. Difficulty navigating bureaucracies, difficulty accessing and using technology. I don't have an email. I may not use a phone, right? A lack of transportation, work duties. Limiting participation. I may have a job, a whole 9 to 5 job I'll go to that doesn't allow me, right, to come to appointments during the daytime in offices. Maybe I'm geographically isolated, right? Maybe I live in a area where I can't get to the freeway as accessible as other people can. A failure to account for cultural differences and help-seeking behaviors, right? What's good for one person may not be good for another, right? The behavior in one person may not be an indicator of behavior for the group. Exclusion of renters, the lack of autonomy and decisions, right? The prolonged loss of electricity, water, and heat due to damages. These can all bring to about a lot of barriers that make it even more difficult for our clients in the disaster setting to get the help that they need, right? And so trauma-informed care is an approach is about changing the way we work in order to be aware of the trauma that people have experienced. And this includes doing everything we can to make sure we're not unintentionally making circumstances worse for people that we are helping or what's known as re-traumatizing them, right? So it's about being able to recognize and respond to disaster survivors in ways that are sensitive to their emotional, physical, and psychological state, whether that's stress, trauma, a range of emotions that they could be experiencing. Okay, so we're deeply interested in the whole situation, the whole context surrounding a person, and not just a single problem that they may be encountering or talking to you about. You don't need to be a trained mental health worker to be trauma informed. You can just be anyone engaging with the public, right? That's why it's important whether you're helping in disaster or helping in benefits or housing rights, right? Um, we can all be trauma informed. And even though you don't provide clinical trauma informed care interventions, it's important that we do look at the whole person, the whole context to get a better window into how we can best help that person. So, what are some of the challenges, right? Well, for starters, there are challenges when working with disaster communities and clients, right? For instance, right, even well-intentioned recovery efforts can encounter significant barriers, right? And I know this from a literature review study that was conducted after the wildfires in California in 2018 and 2019 that talked about well, respondents really relayed stories from residents who had invested their entire savings in rebuilding back their homes, exactly had they had as they had been before the disaster, but they later realized that, they had not taken the steps to really adapt their property to the new changing landscape. And as such, their homes were left more vulnerable and less valuable and insurable. So this kind of exemplifies the challenges of balancing a community's desire to quickly return to normal, right? um, that with also while also like being able to withstand the evolving hazards and risk associated with a changing climate. And so really those respondents also talked about, outside organizations coming in and sometimes over-promising to reassure communities, right? And when those groups couldn't follow through due to limited capacity or unclear scope or budget constraints, maybe new problems and frustrations could emerge from that. And from that, external actors, right? External actors, external programs, right, that aren't embedded in these communities may present themselves as experts while overlooking the need for community storytelling, right, and the integration of local knowledge and values, and the expert victim dynamic that can be present. And sometimes when external actors can go into these communities, can reinforce historical marginalization, deepen feelings of disempowerment, and increase community distrust towards government authority. So this is really important, right? And when looking at the challenges, it's not only about how we communicate on a micro sense, but also on a macro sense, right? Organizationally and community wide, how we interpret and go about going into these communities and making sure that these communities have the opportunity to tell their stories, and we have a collaborative approach, right? A collaborative approach. And just important, right? We're talking about disaster settings, right? I want to briefly touch on the Maslow's hierarchy of needs because it's really important. And this is a pyramid, right, that talks about pretty much the physiological needs, the safety needs, loving and belonging, esteem, and self-actualization. But the bottom, the physiological needs, I really want to touch on because this is the foundation of the hierarchy of needs, right? So Maslow's hierarchy is a motivational theory in psychology that comprises a five-tier model of human needs, right? And the needs lower down on the pyramid must be satisfied before individuals can attend to needs higher up. And so what we see here is that physiological needs are the most important, right? They must be satisfied before we can get to safety, love and belonging, esteem, and self-actualization. So physiological, right? Safety needs are the most important. The desire for a predictable and secure life, protection from danger, shelter, right? Financial stability, health. And what we see in disaster settings is these physiological needs are not being met, which makes the safety needs, the love and belonging, and the esteem needs very much harder to get to. Right. And so when we're working with these clients, recognize that the physiological needs, if they're not being met, it could be harder for that person to feel safe, right? It could be harder for that person to attend meetings, right? Be on time. Um, be well rested, maybe because their physiological needs are not being met. So that's really what I wanted you to take away from this slide. How about disasters and trauma, right? On a micro sense. Well, first, people, right, to cope with these stressful feelings, they may adopt avoidance behavior, which means avoiding reminders, maybe limiting attendance at meetings. Maybe when meetings become too intense, they may stop attending meetings altogether or gatherings, withdraw from participation. Um, most people usually only experience transient distress that resolves on its own. However, up to 30% of disaster survivors may experience PTSD early on, and others may develop trauma symptoms 1 year or more after the disaster. So keep that in mind. According to a McFarland and Norris article, natural disasters are stressful events that have an acute onset, but are experiences experienced collectively, right? And are time delimited, meaning they don't have a time limit. Nearly one-third of a disaster-affected people may experience negative mental health consequences, such as PTSD, which was previously mentioned, maybe anxiety, depression, others, right? There's other kind of outcomes as well. Traumatized persons working on their community's recovery may be simultaneously dealing with their own feelings of depression, anxiety, and hopelessness, and the resulting impairment to concentration and ability to work. Okay. And so these are all things that can factor in on a micro level when you're dealing with the client, how that client may have anxiety, how that client may be avoidant, they may stop attending, right? And they may be dealing with their own feelings of depression, anxiety, and hopelessness, and kind of working through and processing that at their own pace. So what might it look like in our work? What might trauma look like in our work? What may look like an inability for a client to complete tasks that you may ask them to do. It may look like disorganization from a client or an inability to complete the forms, a difficulty to reach a client as a client is coping with life and other situations, confusion, maybe an inability to remember what day exactly it was, the details, the time, maybe irritable, maybe they're really reactive, maybe they want to vent, repetitive phone calls from clients that to get answers about certain things, maybe to get clarifying questions, and then the difficulty accepting change or proposed change, right? These can all These can all be telltale indicators and signs, not always, but they can be signs when looked at together of trauma in our work and how we work with the clients. So, what are some of the core principles of trauma-informed care? Well, what is trauma-informed care? I guess we got to start there, right? And it's an approach, like I previously said, based on the knowledge of the impact of trauma, aimed at ensuring environments and services are welcoming and engaging for service recipients and the staff, right? So it's not a common definition of trauma-informed care, but we should strive to, have an awareness of the prevalence of trauma, an understanding of the impact of trauma on physical, emotional, and mental health, as well as on behaviors and engagement to services, and then understanding that current service systems can re-traumatize individuals with the way they may be coded, worded, and we need to go about getting around those barriers. So some of the principles are safety, right? Staff and all those experience physical and psychological safety, trustworthiness, and transparency. Decisions are made with transparency and cultivating an ethos of trust. What about peer support? Getting support from your coworker, right? Stories and experiences are shared to facilitate recovery, even for our clients as well, right? Peer support, community, collective, right? Collaborative. This is what peer support looks like. Collaboration and mutuality, right? Power differences are level between the client and the provider. Decisions are shared as to why we reach the decision between all involved. Empowerment, right? Positive attributes and experiences are built on, right? We call this a strengths-based perspective when we're looking at a client's strengths. Choices offered. Target setting is practiced and self-advocacy is promoted, right? We promote people to advocate on behalf of themselves. And then respect for diversity as well. We try to overcome stereotypes to recognize an individual's needs in the moment. And not only that, but maybe the context around them so we can avoid re traumatizing them or re engaging them with any traumatizing behaviors or language. Okay, so what are some strategies in disaster settings that we can use? Well, in a disaster context, trauma can have a widespread impact, and there are various paths to recovery. So, an individual's experience of trauma may be accompanied with specific signs and symptoms of trauma, um, and so the response from individuals and organizations should be comprehensive and integrative, right, into the program. And attempts should be made to prevent re-traumatization. We prioritize trust building, transparency, social connectedness, and we try to reduce the impact of trauma through collaborative community processes. Okay. Community members become seen as active participants in the recovery process, not passive bystanders. Okay, so making sure there's a comfortable seat ready, right? A little clutter around, the space is as quiet as possible. Few sensory distractions. That's what it means when you're presenting a welcoming environment, right? Your body language, right? Be aware of your body language on your end and on their end. Try to present yourself with an open and welcoming posture, right? Establish rapport. You may ask the survivor what their name is and how they're doing, right? Introduce yourself, introduce your role, acknowledge and validate, right? It's okay if the survivor displays vulnerable emotions with you. It's okay to acknowledge and validate their feelings. You might have the survivor create a sense of calm by saying, like, before we continue, why don't we take a few deep breaths together, right? Before we continue with the story, or offer nourishment. I see a lot of legal advocates do this already in the office, but offer them water, right? Do they want to snack at all? Moving together can create a feeling of connection and calm, and be clear and set intentions too. And then be mindful of pace, right? Check to see if they have any questions before moving forward. Ask them if they need a moment to process your words. Let them set the pace, and then you try to mirror it. So, what are some considerations also when we're thinking about trauma-informed care? Well, historical, cultural, and gender issues, right? We want to work with local partners to understand community context, right? In what context was this community built? What's the population within this community? What's the sources of local pride? Is there a history of trauma? Is there equitable access for all groups here, right? Safety, supporting physical and psychological safety at all times. Transparency and trustworthiness, building trust with the community through open, transparent communication and being reliable and accountable for our actions. We want to do what we say and say what we do. All right, peer support. We want to provide space for peer-to-peer collaboration within the community, and also promote local resources within the community to our clients. Right, empowerment and choice. We want to recognize and empower the community as decision makers, and a value community experience. We want to be reciprocal in our interactions, and avoid being extractive, meaning avoid going into these communities and being extractive and just looking at the client. Um, the client provider relationship and really looking at these communities as collaborators, right? And telling their stories in their context, right? And in their recovery plan as well. And collaboration and mutuality being the last one, promoting community voices and initiatives and providing options for participation and decision making. These are systemic challenges that can be difficult for us to always influence in our role, but it's important to focus on what we can influence in our interactions with survivors, right? Compassion can really change the recovery experience for survivors. Connection, connection and compassion can really do a lot, and they don't have anything to do with how many resources you may have shared with the client or how good you are or how knowledgeable you are at your job. And so this just it just gets more into the inner context of like the holistic view of trauma-informed care and how it looks at cultural and historical issues, safety, right? Trustworthiness and transparency on the micro level, peer support, that's that collaboration, empowerment and choice. It's also that collaboration, right? We want to empower people to self-advocate, right? To advocate for themselves. We also want them to support peer-to-peer interactions and let them make meaning of their own community and their own recovery process, right? And then we want to foster collaboration and mutuality. We want to value community experience by building in time for input and story sharing and honoring and seeking local knowledge and expertise. Okay, we want to acknowledge that we don't have all the answers sometimes. Right, it's a great answer. I don't have all the answers. And be clear about what practitioners' role and scope are. Engage people as active partners and participants. Okay, we want to actively listen. Okay, we want to understand the historical context. All right, we want to acknowledge trauma. All right, all of these things are important in the trauma informed care. Okay. So on a micro level, what are we doing after an event, right? Well, our goal, we want to build trust and not re-traumatize the survivor. That should be the number one goal. We want to build that rapport, right? We want to make sure that client feels comfortable enough sharing their stories with us, and then we want to avoid re-traumatizing them. And then we want to listen to the client. We want to adjust uh, key strategies like adjusting routine strategies or environment as needed, and also inducing yourself, right, managing expectations and taking the time to practice being trauma aware. Okay. And when you're talking about listening to the client, adjusting routine strategies is meaning for yourself. So if the client says that maybe they want to meet at 3 o'clock, right, and maybe your 3 o'clock is always with the meeting, maybe you need to adjust your routine strategies to maybe meet that need for that client. That's what it would mean. Okay, so what about this? What about creative report and active listening? This is the next step, right? Explain the process. Explain how much time you're going to have, right? The purpose and goal of the meeting, why you may be taking notes, etc. Really explaining the process can help ease that client's anxiety, right? And environment. Confirm a comfortable, safe place to discuss their case. You want to listen to your client's voice, their body language. You want to practice active listening. You want to have reflective. Summaries when people are talking, right? You want to offer reflections. You want to really validate a client's experience. You want to ask, would you like to take a break? Maybe again, going back to that pace thing, right? You want to get on the client's pace. And remember, silence is acceptable. It's acceptable to be silent. That's a part of emotional processing, right? It's hard to emotional process in a loud room. And so silence is a part of that. And offer non-judgmental responses and practice other active listening techniques. Um, as I said, right? And responding with compassion. I can't believe that happened, right? I'm so sorry for you. Tell me how I can support you the most right now, right? These are all great ways to reflect on someone sharing with you some things that are hurtful for them. Confirming details and goals, right? So we want to confirm, want to gather facts during this meeting, we want to gather facts about their situation, right? We want to gather and identify needed documents. We want to ask clarifying questions. But it also accept the client may not have all the answers, and that may be okay. Okay. Try open-ended questions for introductory questions and building rapport. And then close clear-ended questions for specific information. What was your address, right? We want to have those closed, clear-ended questions, maybe yes-ended questions if we're trying to get information really quickly and efficiently. But open-ended questions, maybe if we want to start building rapport and develop more of a relationship and a collaborative approach with the client. And then lastly, you want to confirm goals. You want to make a plan for the next steps. And you want to recognize your role as an advocate in their recovery process. Okay. All right, so supporting survivors, right? In summary, right, we want to develop a basic understanding of trauma and what it may look like in a client's behavior. We want to recognize that people are trying their best to cope the best way they can, and they may be in survival mode. Okay, they may be on that low end of that pyramid where their physiological needs are not being met. Explain processes in the beginning of your interactions and throughout the process. This helps set expectation, right? So a client can know what's coming next. Allow clients to take their time and take breaks as needed. And explore what has worked for them in the past and leverage their strengths. And then lastly, take care of yourself. This is one of the more important things to trauma-informed care, but trauma-informed care only works if the provider is taking care of themselves as well. So please take care of yourself, and we'll have more go on that. So in review, right? I just wanted to put these up. These are just kind of a rehashing of things that we already talked about, right? But just talking about the choices, letting the client set the priorities, non-judgmental responses, clarifying questions, breaking paperwork into small steps, right? Acknowledging system inequities sometimes, keeping tasks simple, right? Allowing silence. So these are all just kind of a review of the different, some of the different principles and some of the different behaviors in trauma-informed care. This is what it would kind of look like and play out like, right? And then lastly, let's talk about provider well-being. Let's talk about ourselves. Let's talk about ourselves as providers, okay? So the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet, okay? So secondary traumatic stress and compassion fatigue are very real. And witnessing a post-disaster environment and hearing all the first-hand experiences of survivors can have a significant impact on your emotional, mental, and physical well-being, okay? And this environment can be more challenging if you have personally survived a disaster, right? And so our symptoms can mimic those of the person who's experienced the trauma directly, and we want to be cognizant and aware of that. So how do we do that? All right, well, we want to have self-care. We want to learn what our role will be. We want to try to work in teams and debrief with our coworkers if necessary. We want to be aware of burnout and secondary traumatic stress responses. When we are feeling like that, maybe we need to take some time off. It's not selfish to take breaks or care for yourself. Understanding that first, that it's not selfish to take breaks and care for yourself. We live in a society that prioritizes grinding, right? Working a lot, but it is not selfish to take breaks and care for yourself, okay? As a provider, okay? You need to. Um, Practice breathing and relaxation techniques. That can be self-care. Maintaining a healthy diet and exercise is great self-care. Getting adequate sleep is the best self-care. That's just my own opinion, but for me, yes, I love sleep. Um, we just talked about the oxygen mask principle, right? You must take care of yourself before you can do anything for anything else. See this woman? Right, in airplanes, they always instruct you, put your oxygen mask on first. There, that way you're in a better position to help the person next to you. And that's kind of what the underlying philosophy in trauma-informed care for providers is as well, right? We need to take care of ourselves, and when we're feeling the best version of ourselves as providers, then we can go out and advocate and be the best providers that we can to our clients, okay? So while it's normal to feel overwhelmed, and have conflicting feelings, you can decrease your chances of burnout by gaining awareness of your symptoms and being intentional about having a self-care plan. Okay. We want you to put your oxygen mask on first. Okay. A quick guide just for trauma-informed care. You want to prepare ourselves. You want to ensure safety. You want to build trust, foster choice and collaboration, actively listening, gather information gently, empower the client, be culturally aware of the client's background and historical context, be predictable, and then provide self-care for ourselves. Okay. At the end, I did provide some tips for taking care of yourself, a self-care action plan template as well, and here's some other resources that you can reach out to just on underlying mental health and just for support. And then thank you for your time today. I really, really appreciate it. Here's some of my references for some of the literature that I used today, and I hope you all have learned so much. Thank you.